This is NDTV. And you're watching NDTV 24/7.
Good evening, you're watching NDTV with me, Rishika Barwa. This is the show where you call us with your questions related to the coronavirus, and we have a panel of expert doctors joining us on the broadcast this evening, and they will be answering some of those questions for you. Dr. Sahana Shetty is with us. She's a consultant endocrinologist from the Department of Endocrinology. She's joining us from Manipal. We have Dr. Amarpal Singh Gulati. He is a senior consultant and the head of cardiology at the Synergy Institute of Medical Sciences from Dehradun. Appreciate you, doctors, for being with us on the broadcast. I'm going to take the liberty to ask you the first question. It's very interesting because the Health Ministry today has said that home isolation of patients with mild symptoms or asymptomatic patients is possible. So those people who have the infrastructure at home to be able to take care of patients can actually treat them at home. What does this mean? Dr. Shetty, if I could begin by asking you, who is eligible for home care and what does home care of COVID patients mean?
Okay, so if you look at the symptomatology and the presentations of COVID-19, we know that 80% of the patients usually have a very mild illness and most of them recover by 2 weeks. It's only 10 to 15% of the patients who might require respiratory support and hospital admissions, and only 5% would be critically ill and requiring a ventilatory support or further assistance. So if we're talking about this 80% of cases who are mild. And these are the patients who just have very mild symptoms like.
All right, we seem to have lost that line with Dr. Shetty. We'll try and reconnect with her in just a bit. But our first caller, Manisha, is calling from Kolkata. Go ahead.
Hello, doctors. Very good evening. My question was, a lot of people are talking about immunity and people with low immunity are really vulnerable to this virus. Would you recommend having some over-the-counter medications like supplements like A to Z to improve my immunity against this virus?
Dr. Gulati, how can one improve immunity, and is there any medication that you recommend to improve immunity?
Well, the best part is I think we can just improve our diet, take a balanced diet. And the interesting part is that there have been some indications from the Ayush ministry which have given some Ayurvedic preparations. It is still in the pipeline and we are waiting for those guidelines. It has been said from the PMO office directly that you can go with those preparations and which probably improves the immunity. But
right.
As of now, a balanced diet, good exercise, even if you are at home, working out a little bit every day, and a balanced diet and taking your regular medications regularly is more important.
Right. Is there anything, Dr. Shetty, that you'd like to add? We lost that line with you there briefly, but what about building your immunity? Is there any over-the-counter medication that you recommend?
As of now, there are no over-the-counter medications which have shown to be beneficial in terms of improving our immunity. But yes, some of the antioxidants like vitamin C, which are rich in certain foods, may be beneficial. Most important thing is to eat healthy food and be active. Being active and relaxed and things like yoga can boost up our immunity. But as such, there are no proven.
So balanced diet and whatever good exercises and practices you can follow at home is what the doctors recommend. Arun, our next caller, is dialing in from Hyderabad. Go ahead.
Hi. What I want to know is to either of the doctors can answer it. What is the role of a UV lamp in sanitizing or in sterilizing?
Can a UV lamp help in these cases, Dr. Gulati?
The UV lamps have come into the picture, once to sanitize the gadgets, what we have usually. But it is also not a foolproof solution. There are some companies marketing a UV light, sanitizers, but that's not proved yet. So the best way is to sanitize with an alcohol-based sanitizer, and regularly wash hands and stay at home.
Right. Dr. Shetty, anything you'd like to add? All right. We seem to be having some audio trouble with Dr. Shetty. I'm afraid we can't hear you. at this moment. We'll try and reconnect with you in just a bit. Dr. Gulati, if I could just come back to you and just a follow-up question on what I initially began by asking. The rules for home care of a COVID patient. The government has said, and many would say that this is actually a very welcome move because it would prevent people, from overcrowding hospitals, especially those who have mild symptoms or those patients who are completely asymptomatic. But what about the risk it poses to family members? What are the rules and regulations that should be followed at home, if a COVID patient is recovering within the premises of their own home?
Right. So I would like to go into the pathogenesis of this infection first of all before I answer this question. See, COVID infection or SARS coronavirus 2 infection is it's an infectious disease. It spreads a lot. If you just recollect the influenza pandemic which occurred in 1918, that had a reproductive number far lower than the reproductive number of SARS coronavirus 2. What is reproductive number? It means it is the number of persons infectious person or infected person will spread to. For example, if I am a COVID patient, I will spread to an average of approximately 3 patients. 3 more people will get infected by me in a naive population or in a new population. This number is far more ahead than the influenza pandemic we are talking about in 1918. So the idea is to isolate the patient. Again, right. There are 2 terms. One is an isolation, one is quarantine. Now they are 2 different terms. So what is isolation? Isolation is keeping separately a patient of COVID-19, whether at home or at any other center or a transparent COVID hospital, whatever it is. But it is important and it is exactly safe. So what we have to do is we have to follow some guidelines. For example, he should be isolated in a particular room. Nobody else should be allowed to enter the room without a protective equipment, right. Which obviously is not possible at home. So if you are at home and you are suspected to have COVID infection, it is better to isolate yourself in a right. particular room and let somebody, one of your family members, help you in all your daily activities from outside, from a distance at least of 2 meters from away from the patient. Preferably you should be isolated in a particular room and nobody else should be allowed into that room or right. To use the bathroom in which you are using the bathroom, the COVID patient. So this is what a self-isolation means. On the other hand, quarantine is totally different. Quarantine is keeping separate a person who has been exposed to a suspected COVID patient. So right. He's a normal patient who has been exposed. So that is a different aspect.
Right.
That can also be done at home.
Well, so that's very useful information, Doctor, that you've shared with us. I want to go across to our next caller. Dr. Ramana Rao is calling from Hyderabad. Go ahead.
Good evening to all of you.
Good evening.
Good evening. Go ahead.
I have after lockdown, everybody is saying social distancing and wearing a mask is mandatory. Fine. What are the precautions we have to take to accept any courier or groceries after lockdown?
All right, Dr. Shetty, after lockdown is lifted, what are the kind of precautions that one still needs to take?
Well, so with COVID-19, what we are worried about is droplet infection when we are dealing with groceries or the couriers. So the important advice would be to follow hand hygiene. That is, you after receiving the parcel or the groceries, it's important that you wash your hand. Important thing is to wash it thoroughly with soap and water for at least 20 seconds. This is not available. You can use a sanitizer which contains 60% alcohol. And when you've gone for a grocery shopping, it is important that you maintain social distancing, to cover your face with a mask and avoid touching your eyes, nose and mouth. And as soon as you get back home, wash your hands with soap and water. Also, while dealing with your groceries, right. Because you have bought from the market, you have to follow hand hygiene.
So what you're essentially saying is that the rules in terms of hygiene and sanitization pretty much remain the same whether you're in a state of lockdown or even once the lockdown is partially lifted. Tarun, our next caller, is dialing in from New Delhi. Go ahead.
Hello, yes ma'am, I have one question. Actually, I am have condition of fatty liver from last 3 years and some this blood pressure also high. So what precaution that I can take from home only because the lockdown we cannot do so much from inside, and what other beside eating having right. the
so let me take that as well to Dr. Shetty. Dr. Shetty, anybody who has a fatty liver condition, what would you recommend to them?
Yeah, so when talking about fatty liver or hypertension, we're talking about metabolic diseases. These are lifestyle diseases. Much of this can be controlled by following a balanced diet, which is calorie controlled and is less calorie, less carbohydrates, more in protein and fiber. And most important thing is also to be physically active, especially during this long time period. Have a routine, follow the routine, take time for physical activity, do household chores, it helps you in being physically active. And if you have medications, strictly take those medications. An important thing is to avoid exposure to infection. So again, boils to the same point of social distancing, frequent hand hygiene and hand washing, and using a mask if you're going into public places.
So essentially a balanced diet and exercise is essential for most people who have conditions or rather predisposed conditions. Dr. Gulati, is there anything that you'd like to add from a cardiology point of view?
Yes, keep yourself busy, do some regular workout at home only, and take your medications regularly. I think that's the goal.
Right. It is usually recommended to heart patients that they should exercise and go down for a walk. That's unfortunately not something most can do. So is there any special advice that you'd like to give them?
Well, nowadays it's not difficult to working out at home also.
Right.
So even if you are in your balcony, if you are in your room also.
So you must exercise, but you just should do it within the confines of your home.
Yes,
Firoz is calling us from Mumbai. Go ahead.
Hello, good evening.
Good evening. Go ahead.
Yeah, my question is, whatever the vegetables and fruits we buy from vendor and whoever is delivering it to our home, so if we wash it with hot water, will that be enough to clean it, or is it necessary to wash it with soap water or any other similar thing?
All right. Dr. Shetty, any recommendation on how vegetables can be sanitized?
So far, the recommendations from bodies all over has been to just wash it with water, especially in a running water. Most important thing again would be hand hygiene, to wash your hand before and after touching these vegetables. Generally, we don't advise using soap or disinfectants in eatables, especially when you're dealing with the eatables.
All right. So it isn't advised to use soap or any other object. But what's very interesting is that the doctor says that you must wash your own hands. So wash the vegetables under running water, but ensure that you wash your own hands. Dr. Gulati, is there anything you'd like to add? It's not just vegetables, whatever is coming in, from outside. It's, even deliveries, for instance. We had a case in Delhi where a delivery staff had in fact tested positive. Families were quarantined after that. What is the kind of SOP, Dr. Gulati, you think people should follow?
See, the virus spreads by either aerosols or by fomite. Fomite is the larger droplets which are placed on certain surfaces. And the life of this virus is more or prolonged, particularly on smooth surfaces. So we should be a little careful in touching the smooth surfaces, while the other surfaces like food substances, paper, cardboard is not that dangerous. But still, hand washing before touching and after is more important, rather than trying to sanitize everything what we brought into the house.
So it's very important because you can't sanitize everything that comes into the house, but you should sanitize your own hands so that you don't touch your face after touching any of those things. Surbhi Bhatia, next caller, is dialing in. Go ahead, from Faridabad. Go ahead.
Yeah, ma'am, I just wanted to know what is herd immunity.
All right. Dr. Shetty, what is herd immunity? Could you break it down for our viewers?
So herd immunity is when the infected people, after some time we know that they develop immunity, they develop antibodies which makes them immune. But and then when a large group of people develop this kind of immunity, generally they say in epidemic around 50% or sometimes up to 70% of people, if they get infected, then they kind of develop antibodies which they can shed in the feces and other secretions, which then spreads to other people, and then community as a whole gets immune to the infection. So this is herd immunity. So once we develop herd immunity is the phase when the epidemic is going to be over.
All right. Dr. Gulati, anything you'd like to add?
I'll put an example. For example, there are 10 people in a room. One patient is a suspected COVID patient. He is capable of spreading the virus to 9 people in that room. But imagine if out of those 10 people, 5 or 6 people already have antibodies to the virus. Then he is capable of spreading the virus only to 4 people. I mean, and out of 4, it is not likely that he will, directly transmit the infection to all 4 of them.
Right.
So the chance of transmission grossly goes down if herd immunity is developed.
All right. Our next caller, Narsimha, is dialing in from Chennai. Go ahead.
Hello.
Yes, please ask your question.
Yeah, my question is regarding vaccine. Why does it take a very long time to develop a vaccine? And if another country finds a vaccine, what are our chances in India to get this vaccine?
All right, very, very interesting question. Would any of the doctors, who perhaps researching on vaccine like to take that on?
Well,
All right.
Hello?
So I think Dr. Gulati, if you'd like to go first, and then I'll come to you, Dr. Shetty.
Well, developing a vaccine is not an easy job. There are so many ways and so many types of vaccines which can be developed against the virus infections. And believe me, if a vaccine is developed for coronavirus, this will be the fastest developed vaccine throughout so far in the history, in the medical history, because already phase 1 trials are going on and direct in human trials. First in human trials have already started in many countries, including India. So it's not that we are not trying. Everybody is trying to develop a vaccine. So there are some 48 industries which are behind vaccines, but there is something known as antibody dependent enhancement. So what we do is, before we develop a vaccine in first human trial, we usually check the vaccine in primates, non-human primates, that is in monkeys. And there is a phenomenon known as antibody dependent enhancement, in which, if you give a vaccine, actually it might enhance the disease, and that may be harmful to the patient. So that's why it is first tested in the animals, and their animals are followed up for the prevention of the disease.
But Dr. Shetty, there are vaccines that are in the human trial stage as well. Is there anything that you'd like to add? Any reason why one should believe that we will have a vaccine soon? And in the event that there's another country that actually gets the vaccine before we do, what are the chances of us getting that vaccine here in India?
So in general, the minimum duration required for a vaccine development would be 1 year, because initially they'll have to develop something and test it, whether it is safe, whether it is efficacious, and then study it in human subjects, and then study it in patients. Only then it will be available for clinical use. Of course, the scientists all over the world are trying, and several processes are being fastened.
Right.
And regarding the second question of whether it will be available in India, of course, I think if it is developed anywhere else across the globe, it should be made available to most of the countries.
Ivan, our next caller, is calling from Mumbai. Go ahead.
Yes, ma'am. My question is, how long can an asymptomatic patient remain asymptomatic before developing symptoms? Would it be 1 or 2 months? And is there a relapse for this disease?
All right. Dr. Shetty, anything on asymptomatic patients? How long can they remain asymptomatic? Do asymptomatic patients ever exhibit any symptoms?
So when we say asymptomatic, that means that these people do not exhibit symptoms.
Right.
So they may remain completely asymptomatic, and then the low virus load may come down and they may be cured. So they may not exhibit any symptoms at all. And as of now, I think the data showed that 80% of our patients are asymptomatic. Some of them may develop symptoms in 14 days' time, but many of them may remain asymptomatic.
And now, Dr. Gulati, it's also being said that the incubation period could be as long as 28 days and not just 14 days.
Yes, there are some studies. There are some case studies in which the incubation period is found to be more than 14 days, as long as 25 days. One patient has been detected who became symptomatic after 25 days.
All right. Shafat from Srinagar is our next caller. Go ahead.
Hello.
Yes, go ahead. Ask your question.
My question is regarding the food.
Okay.
Okay. My question is regarding the food. Okay. During this corona problem, what foods we should take and what foods we should avoid? Number one. Number two, these days we are at home, and what foods we should avoid so that we will not be
all right. Dr. Shetty, is there any correlation between diet and the susceptibility to the virus per se?
Okay. So if you're looking at transmission dynamics, we know that it is transmitted only through close contact or droplet infections and fomites. So it is not transmitted through oral transmissions. So there is no risk of transmitted through any food. But of course, if you're talking in terms of intake of food, as such, there are no specific foods which either protects us from preventing infection or which predisposes to developing infection. But of course, during the lockdown period, we should maintain a balanced diet and prevent putting on weight, because obesity is one of the risk factors in the studies so far.
So that's very interesting that you should avoid the risk of putting on weight because obesity is actually a condition, but there's no direct correlation with the food that you're eating. Manpreet, our next caller, is dialing in from Mumbai. Go ahead.
Yeah, myself, Mr. Manpreet, I'm calling from Mumbai. Sir, I have a small query. Like we want to donate our blood plasma. Okay, we are around 20 to 25 volunteers in our area. We belong to Sign area in Mumbai, and we are healthy people. We have not recovered from like COVID-19. But my query is that can we donate our plasma for the well-being of other patients?
All right. I think Dr. Gulati, if you could take that on, but I'd also just like to give a disclaimer that only a recovered COVID patient can actually donate plasma. Dr. Gulati will be able to elaborate further.
Yes, plasma therapy is the only known therapy for COVID infection, and you can donate plasma only if you have antibodies in it. So you should be infected with COVID-19 and you should recover from COVID-19, and your antibody titer should be good enough so that we can collect those antibodies through your plasma and then transfuse it to a patient of COVID-19. So only if you have antibodies, then only it's use of taking your plasma.
So important clarification that you can't just donate blood plasma. You have to have recovered from the coronavirus infection to be able to donate your plasma. I have 30 seconds left on the broadcast. Chandan Das, last caller from Kolkata. Please keep your question short. Sorry, we couldn't hear you, sir.
हेलो
Yes, go ahead.
हाँ, बोल रहे हैं जो हम लोग कोई सामान लेके आया तो कितने वायरस उस सामान में कितना देर इफेक्टिव रहता है?
All right, Dr. Shetty, very quickly, how long can the virus survive on surfaces?
Okay, the survival of the viruses depends on the type of the surface, it depends on the environmental temperature and humidity. Roughly they say on the plastics and steel, the study says that it can stay for 72 hours, on cardboard they can stay for a day, and on copper around 4 hours. But disinfecting can quickly, within a minute, completely clear the virus.
All right. Appreciate you, doctors, for being with us on the broadcast, for sparing the time of day and answering all the questions so patiently. That's all we have time for on the show this evening. Thank you for watching.